G'day, my name's Joseph Sgroi, an obstetrician, gynaecologist and fertility specialist here in Melbourne, practicing at Freemasons Hospital and Melbourne IVF. So I manage patients who are either in their preconception stage, so contemplating pregnancy and providing advice on pre-pregnancy, all the way through pregnancy and childbirth itself. Obstetrics and gynaecology, and also adding in the fertility, is a bit of a labour of love. It takes up a lot of time. Like, I start work most days at 7 o'clock and won't finish at 6 o'clock till 6 o'clock at night, and I don't regret any of that. It is pretty full on. Certainly on the weekends as well, if there's patients that need me. You can't try to stop a baby coming when a baby needs to come. So it's pretty much full on 24/7. So I think one of the things is you come out of medicine and you really don't get a sense of any business. You don't get a sense of what other business systems you can put in place to make yourself quite efficient. And so we've gone from pretty much a paper-based system with lots of faxes coming in and out of the practice to now something that's a cloud-based system, and it's really bringing medicine into the 21st century. So I think as a medical practitioner, you want to, number one, provide the best possible outcomes for your patients, and also to have that continual connectivity with your patients. And so Clinic to Cloud through the apps affords that connectivity.
Clinic to Cloud is a practice management and clinical management application that is focused on the primary healthcare sector. So anything from a GP to a specialist. And the application basically runs their business, from scheduling a patient through to consulting, clinical notes, and back out to invoicing, where it's integrated with Medicare, Eclipse, DVA, and as well as being able to report and output data to your financial application. Obviously, clinicians have a duty of care, and part of that duty of care is their data, ensuring that the patient data, clinical data is well kept and safe, and knowing that a trusted brand like Microsoft Azure is hosting their data, and the fact that it's hosted locally gives them that assurance, and then along with the security aspect of it. There's no way a small practice or even a large practice or a hospital can afford to spend on the security aspect of things and the backup aspect of things as much as Microsoft could.
It's really reassuring from my perspective to have a product that's linked with Microsoft and is a company that you then know has a lot of data integrity and safety features. I mean, we're still going to need doctors. We're still going to need that face-to-face interaction and that visceral or that palpable sensation of being able to examine a patient. But more importantly, we also need to have the flexibility and we need to have the accessibility of our data at any point in time. And so we shouldn't be fearful of embracing the technology as it comes to hand, because it's only going to enhance not only our clinical practice, not only the amount of patients we see and the efficiency of our practice managers, but more importantly, our patient outcomes. Also, from my perspective, being able to access information 24/7 is vital, particularly in obstetrics and gynaecology. You know, some nights the pager goes off, I'm ringing a patient and it could be Joan Smith. You know, getting onto the app, being able to look at the app, being able to see the patient's clinical history, being able to see where they're at in terms of their pregnancy or anything, any practitioner being able to see specifically what's going on at any given point in time means you can answer the patient's questions a lot more efficiently, and more importantly provide them exactly the right information they need at that point in time, and you don't have to be near your desktop to do that.
I want clinicians to think about Clinic to Cloud as an enabler for them to go into private practice without the worries and the concerns of having complex IT system or being wedded to IT guys. I want them to focus on running their practice, focus on patient care, and think about what value they can get out of a true cloud solution, things like business intelligence and clinical intelligence, and the fact that their data and their business are safe in the meantime.
I think, you know, you only have to look at the growth of my practice. You know, I think that having a system which not only allows me to have flexibility and accessibility, but also higher connectivity with my patient means that my practice has grown, and that's probably the biggest selling feature for me, really. Patients might like it and that might be all fluffy and really nice, but if I can see the natural fact it's providing a better quality service to my patient with better health outcomes, well then it's going to be paramount.